The Lagos State Traffic Management Authority LASTMA says that a commercial minibus driver and a passenger were knocked unconscious after a Ford Jeep collided with their bus. LASTMA's General Manager Olalekan Bakari confirmed the incident in a statement by Taufik Adebayo, the Director of Public Affairs and Enlightenment Department of LASTMA. Bakari said that the accident occurred near Ikota School, heading towards Ajah along the heavily trafficked Lekki-Ajah corridor. He stated that the crash involved a white Ford Jeep with the plate number KWL574CY and a fully loaded commercial minibus with the plate number FST207YK. Initially, findings suggest the Jeep's driver, allegedly speeding, lost control and crashed violently into the moving minibus, Bakari revealed. The impact severely damaged the minibus. The driver reportedly slipped into a coma with a serious fracture to his right arm. According to Bakari, a passenger suffered an intense nasal bleeding and lost consciousness at the crash scene. In order to reduce the number of doctors going abroad to practice, the ongoing Medical Director of Federal Medical Center FMC, Abeokuta Professor Adewale Musa Olomu, has advised the federal government to increase the remuneration to doctors in the country. Musa Olomu made this known on Thursday in Abeokuta while briefing the newsmen as he gives accounts of his stewardship as the head of the medical center for 8 years in office. Our correspondent recalled the World Health Organization WHO had in 2025 research estimated that Nigeria has a doctor-to-patient ratio of approximately 1:9,083, meaning that there is a severe shortage of doctors in the country. Although the WHO recommended the ratio of doctor to patients is 1:600, Musa Olomu, however, allows the federal government to investigate in the health sector, especially with the settings of the Federal University of Medical Science in Abeokuta. He noted that for the country to harness the full potential of his homegrown trained medical practitioners, the federal government must also ensure adequate salary structure in tandem with world best practices is put in place.
That they are increasing the number of health workers that have been going to US, UK, Europe. Let them also give us incentives that we deserve. Give us the salary that we deserve, as the colonial masters were doing in those days when they rated us as number 2 immediately after the Governor General. Then doctors will stay. So the best thing they can do, they are taking measures. We thank them. They allow us to use it. They have voted a lot of money into the health sector, good, but the manpower to manage it, yes, they are training pharmacists, doctors, laboratory technologists, and all sorts. But they should make sure that incentives and commensurate salary should be given to us so that we can stay around and do the necessary things.